After your test, you will be able to review the results with the specialist. The form is laid out with the frequencies across the top ranging from 125 to 8,000. This scale is measured in hertz. The higher the number, the higher the pitch. 1,000 is considered the mid-range divider between low and high tones. The vertical scale is a decibel scale and indicates the loudness you need above normal to just barely hear that tone. For convenience, this scale is sometimes referred to as percentage of loss for clarity purposes. Your test will resemble a graph. The further down the mark, the worse the hearing. O's represent the right ear and X's the left ear. These symbols may be replaced with a square and a triangle depending on the test methods needed. The bone test is represented as a left arrow for the right ear and a right arrow for the left ear. Depending on the position of these two tests relative to each other, a medical referral or signed waiver may be needed. These tests will indicate whether your loss is nerve damage or if some condition is blocking the sound from getting into the ear. Conductive loss, which is a combination of both conditions. Nerve damage is correctable only with hearing instruments. Conductive loss may be medically treatable.